This presentation aims to help you understand what to expect when making a referral to ACE Centre for a person who may need specialised AAC services commissioned by NHS England. ACE Centre has been commissioned by NHS England to provide specialised AAC, augmentative and alternative communication services across the North West and Wessex and Thames Valley NHSE specialised commissioning regions since January 2015. Responsibility for providing AAC support to all children and adults who need it lies with local services. NHS England has commissioned specialised AAC services to provide assessment and equipment services to an estimated 10% of this population who have the most complex needs. I'll talk more about that later in the presentation. Ongoing support in the implementation and development of the use of AAC provided by NHSE Specialised AAC services remains the responsibility of local services. NHS England devolves decision-making about services to meet the health needs of their local community to local decision-makers, and consequently it cannot dictate how local commissioners provide services for their local community. Consequently, arrangements for meeting the needs of people who require AAC and who are not or are not yet eligible for NHS England Specialised AAC services are variable. There are 146 services that are commissioned directly by NHS England that are defined as low incidence, high cost services and therefore are more effectively commissioned at a regional or national level. Specialised AAC services sit within the Complex Rehabilitation and Complex Disability Services Clinical Reference Group in the National Programme of Care Trauma. NHS England commissions services regionally and each region has its own specialised AAC service or services. ACE Centre has been commissioned to provide these services for the North West and the Wessex and Thames Valley, the South Central regions of England. If you would like to know the contact details for the NHSE Specialised AAC or EC Environmental Controls service in your area, you can do so by typing your postcode into the lookup field on this webpage, servicefinder.acecentre.net. So, NHS England commissions services for children and adults who have a severe complex communication difficulty associated with a range of physical and or sensory and cognitive impairments, and in addition who have a significant and evidenced discrepancy between their level of linguistic understanding and their ability to express themselves using speech, and who have experience of using AAC, including examples of how this has enabled the person being referred to use a range of communicative functions. We understand that at times it can be challenging to provide the evidence of a person's language discrepancy or to enable someone to use AAC prior to them being referred to our services. Consequently, we have developed a number of resources, including guidance on how to use them, which are available online. I will show you these resources once I've given you a bit more detail about NHS eligibility. So to continue, this includes children and adults who are expected to use complex vocabulary to combine multiple words to compile a sentence, and who require the involvement of a specialist multidisciplinary team, which may include speech and language therapists, healthcare scientists, occupational therapists, and education professionals. In addition, these services are commissioned for children and adults who, if text literate, will require an alternative access method within 18 weeks of referral. So this criterion relates to people with rapidly progressing conditions. We recognise that it is impossible to predict how a person's condition may change over time. However, it is helpful for us to have an indication of that progression over the previous 3 to 4 months prior to a referral being made to ACE Centre. Give us as much detailed information as you can about hand function. It's fine to involve other professionals, such as an OT, in the referral process. It's also really helpful to know about the levels of functional speech throughout the day and week if you're referring someone with a rapidly progressing condition who is losing their speech. So approximate percentages of a person's ability to be understood by speech alone is very useful information. Please do not use this as the first point of call. We need evidence that the person being referred has already trialled AAC, which may include the use of low-tech resources. If a person is not yet eligible, try local routes to funding first, such as approaching local commissioners or using the individual funding request process, which is also sometimes referred to as the effective use of resources. If you search individual funding requests plus your CCG in a search engine, you should be able to find details about how this process works in your area. If you're unsuccessful with establishing funding through this route, the fact that you have tried to seek local funding will assist with applications to alternative funding sources, such as the Sequel Trust or MND Association, and reassure your client that you are doing all you can to meet their needs. Links to these organisations can be found at the end of this presentation. Other eligibility criteria for NHS England Specialised AAC services includes people who require services that have access to a wide range of communication equipment, skills and strategies. So at A Centre we work closely with the wider AAC community to ensure we're kept abreast of the latest developments in AAC, including equipment and research, and we maintain an extensive bank of assessment equipment. Our services are commissioned for people who require services that enable multiple assistive technologies to be integrated into a single means of access and functionality. So, for example, communication, environmental control, computer access and/or a powered wheelchair control. And for people who need communication solutions that are dependent upon bespoke design and construction and/or adaptation. In order to provide this, we have workshop facilities in our A Centre offices to create bespoke solutions for individuals when this is required. This website has been developed recently by all NHSE Specialised AAC and EC services to share information about a wide range of online AAC, assistive technology and EC resources that may be helpful to you. Referrals will be accepted from health, education and social care professionals who are employed by publicly funded organisations. Independent professionals can contribute to the referral and assessment process. It's expected that the referrer will coordinate the assessment and implementation process in partnership with A Centre staff members. And it's really important to emphasise that this is not an onward referral. Also, it is not helpful when we receive referrals from people who are about to leave their service on a longer term, temporary or permanent basis. If this is unavoidable, please detail alternative points of contact for us to liaise with in order to progress your referral. In these instances, we will need contact details for a professional who knows the person being referred and will be able to coordinate the referral from that point onwards. Whilst every effort is made to ensure we respond to each referral in as timely a manner as possible, we are required by NHS England to prioritise referrals in the following instances. Priority will be given to people with a rapidly progressing condition where there is evidence of notable change within the previous 18-week period. Priority will be given to people who meet the criteria and have communication equipment currently, but that has ceased to be functional or is significantly unreliable in order to meet their communication needs. Priority will also be given to people who are exhibiting significant psychological behaviour or behaviour which challenges as a consequence of their inability to communicate without equipment. Please note that you will need to give details about these behaviours in order to help us understand the urgency required to respond. Priority may be given to people who will imminently transition to a new sector, school, college, workplace, environment, or from a rehabilitation provision. Periodically, we experience escalating referrals for people who meet the prioritisation criteria. We're dependent on receiving accurate and detailed information about how the person being referred meets these criteria in order to assist us to plan our services accordingly. What to expect once a referral has been accepted? We'll acknowledge your referral within 10 working days of receipt. We aim to offer an assessment date within 6 weeks of referral acceptance. Equipment identified following assessment will be available on a short or a long-term provision basis. Maintenance and management of equipment is the responsibility of A Centre. Consequently, we will periodically review equipment in order to ensure it's maintained to an acceptable standard. This is referred to as a planned preventative maintenance or PPM check. Familiarisation training will be provided for the individual family and their professionals. It is expected that the referrer will attend this and cascade training as required. Our services are delivered by multidisciplinary teams of professionals who will consider a range of devices and vocabulary packages as appropriate to the needs of the individual being referred. We will also take into consideration the range of environments and communication partners in which the person being referred needs to communicate, and we will consider integration with existing or other technologies and relevant services. We expect the referrer to provide evidence of NHSE eligibility with examples of AAC resources and strategies that have been used to date. I'm about to show you some resources that can be especially helpful if you're finding it difficult to access equipment or resources yourself. We also expect the referrer to take responsibility for coordination and communication with the individual, their family and/or assistants and A Centre during the assessment process, and in addition to be responsible for the long-term implementation of the recommendations and maintenance of equipment provided. If you're unsure about eligibility, there are a number of other services we offer to assist you. Try calling our free advice line 0800 080 3115, which is available Monday to Friday, 9 a.m. to 5 p.m. If the person answering the phone is unable to advise you, they will ensure another member of the team who is able to assist will contact you. AACbooks.net is a site that allows you to access multimedia support in getting started with AAC. You can view each book online or download them for free into an iOS device via the Apple Store, or just view them within the browser. acentre.org.uk/resources. A Centre has developed lots of resources that are available for you to download and use free of charge, including symbol and alphabet charts. You'll need to register to access them, but they are free. If you want to keep abreast of what's happening in the field of AAC and assistive technology, this free e-newsletter, aacinfo.email to register, will be worth subscribing to. In addition, we offer a range of training opportunities for professionals, individuals with complex communication and learning needs, carers, partners, and families of people with communication needs. This site has been developed more recently by a working party within NHS England, and it's designed to create a suite of tools for you to use in order to champion the establishment or development of local AAC services in your area. You'll need to register to log in order to access the resources, but registration is free, and once into the site you will have access to a wide range of materials that hopefully will be able to help you make a case to your local commissioners about the need for establishing or improving local AAC provision in your area. This resource has been developed in order to offer guidance about AAC services commissioned by NHS England and what is expected to be provided by local commissioning arrangements. It's available on the NHS England website using this link, and it may be helpful to share this with local commissioners, service leads and decision makers in your area. If the person being referred does not meet NHSE criteria, A Centre will provide feedback and guidance on this decision. And in addition, we will endeavour to signpost you to other relevant A Centre services and/or assist you to engage with your local commissioners as appropriate. Another useful source of information and support is the UK chapter of the International Society for AAC, Communication Matters, www.communicationmatters.org.uk. In the event of your referral being deemed as not or not yet eligible for NHS England Specialised AAC services, And if you've been unable to access a local budget or service for support, the following routes may be worth your consideration. Individual funding requests, IFRs, or effective use of resources, as they're sometimes referred to, are designed to accommodate clinical treatments in exceptional circumstances. Whilst not a long-term solution for all local AAC provision, it is a mechanism to pursue in these circumstances. All CCGs have an IFR application process and an IFR panel appointed to make decisions on applications. The following other links are also worth considering, but would be dependent on attempts having been made already to pursue funding through local commissioning arrangements. Thank you.